unfortunately there's a misconception that palliative care means that the doctor's given up hope on the patients and that there's nothing else that can be done for them. However, having that conversation at an early stage is really important for our patients. The feedback that we receive is often that if only I'd known sooner.
The most common misconception that we come up against is that palliative care is only for people who are dying, or that all of the active treatment has to have stopped before people are referred for specialist palliative care.
When we have the team in, it doesn't mean that end of life is imminent. We can have patients that are actually end of life from the moment of diagnosis of a non-curative condition, and that can be anything from cancers to heart failure to conditions that are not appropriate for operations. It doesn't mean that we are stopping all active treatment.
I think there are many common myths surrounding palliative care in terms of patients and probably many staff members feel that you're there for end-of-life medication, syringe drivers, but I think it's way beyond that.
When people hear the word palliative, they tend to automatically think that that's the end, that it's end of life and it's going to happen imminently rather than it being a period of time.
I think the commonest, and particularly from a medical and nursing point of view, is that it relates really just to those last days of life, as opposed to being the sort of longer journey once one knows that life is limited.